He usually drink, but in a small amount on weekend. He is married, have 2 children, and life his with his wife and children.
تمام يلا.
Yeah.
Good afternoon.
All right.
يلا.
Okay, I count the time for you. All right, you can start.
Good afternoon. My name is Dr.
Good
Muhammad Rayab, one
afternoon.
of surgical doctor. May I confirm your name and your age, please?
Yeah, I am Mr. Charles. I am 55 years old.
Mr. Charles, 55 years old. Nice to meet you, Mr. Charles.
Yes.
Today I have been told to ask you some questions regarding your conditions. Is it okay with you?
Yes, can.
So what seems to be your problem today?
Yesterday is my daughter wedding, so I drink a lot of alcohol. So after that, I have severe upper abdominal pain.
Our congratulations for your wedding, your daughter wedding, and
Okay,
I'm very
thank
sorry to
you.
hear that abdominal pain. Could you tell me what is the exact site of that pain?
Yeah, it is in the upper part of my abdomen,
Yes,
in the middle.
I understand. Is the pain increased by time or decrease?
It is intermittent pain, sometimes increase, sometimes
What is
decrease.
the character of the pain?
It is dull aching pain.
Yeah. If I need you to score your pain out of 10, which 0 is the lowest, how could you score your pain?
0 is the lowest. What is the highest?
Highest is 10, from 0 to 10.
Okay, so when it started, it is 7. Now I am in hospital. They give me some medication, so I improved.
Yes, I understand. Do you feel that pain anywhere else into your body?
It is you mean radiation or what you mean?
Yes, I mean radiation, yes.
Radiated to my back.
The pain started suddenly after you drink alcohol, yes?
Yes, after I drink a lot of alcohol, I don't used to drink a lot of alcohol. After that, I have this severe pain.
Yes, yes. Could you tell me how many cups you drank yesterday?
6 cups. 6 or 9, 9 cups. 9 cups. Okay.
Yes, yes. How much you used to drink alcohol in ordinary days?
1 cup in the weekend.
Okay, you mentioned that you have severe abdominal pain. Is it associated with vomiting?
I have nausea and vomiting.
Yes. That pain decrease on leaning forward? On bending
It is
forward?
decreased when leaning forward and increased by eating or drinking anything, spicy thing.
Yes, yes, I understand. Do you have fever?
No fever.
Yes. Do you have discoloration to your body, your skin, your eyes, your brain?
What you mean discoloration?
A change in the color of your skin.
So which
Yellowish,
color?
yellowish,
Yellow.
yellowish,
Okay.
night.
No.
Yes, yes, I understand. Do you have experienced weight loss recently?
No loss of weight.
Yes, I understand. Do you have a change in your appetite recently?
No.
Okay. Do you have any other medical problem other than your problem today?
Like what?
Like increase in your blood pressure, hypertension, diabetes mellitus, cholesterol level?
No.
Okay. Do you have any surgery before?
No surgery.
Any admission to the hospital before?
No.
Any drug, any medication you used to talk?
Any medication used to what?
To talk, medication you have?
No. No. No.
Yes. Do you have any allergy to medication or allergy to food?
I am allergic to seafood.
Yes. Mr. Charles, what's your job?
I am a teacher.
Yes. Whom with you live?
With my wife and 2 children.
Yes. Do you smoke?
Yeah, I smoke 10 cigarettes per day for the last maybe 30 years.
Yes, I understand. Does anyone from your family has a condition similar to your condition today?
No.
Okay. Do you have any headache?
No headache.
Any shortness of breath? Any
No.
chest pain?
No.
Any problem with passing urine or passing stool?
No.
Any muscle pain or any joint pain?
No.
Okay, Mr. Charles, let me in brief summarize to you your case, please. You have you drank alcohol yesterday, about 9 cups. After that, started to feel middle upper superior abdominal pain, intermittent pain, which intermittent pain, dull aching in nature, increase and sometimes decrease and sometimes increase. and sometimes decrease associated with nausea and fever, and you smoke and drink alcohol. Anything else you wanted to add for me, please?
No, thank you.
Okay,
Okay,
thank you.
you take 5 minutes, so it is okay. It's the only my comment is when you start to analyze the pain, it is important at the same time to ask what increase the pain, what decrease the pain. You ask it, but late. You ask about pain, you ask about pain score, and suddenly I think you remember that you don't ask about what increase, what decrease. You ask about what decrease the pain. You ask me if leaning forward decrease the pain. After that, I prompt you or I give you the clue that I am nothing increase the pain. Of course, you have a good point in your presentation is you have empathy because when I tell you it is my daughter wedding, so you say congratulations, you take a proper history, you summarize at the end. After that, no comment about your history because you fulfilled all item like family history, social history, allergy, admission to hospital, other chronic disease, and it is important to enumerate the name of the disease. You ask about other system, you ask about loss of weight, loss of appetite, so it is okay. So the next question, it is what is your, from the history, what is your differential diagnosis or diagnosis?
The acute pancreatitis related due to alcohol, the amount of alcohol.
Acute pancreatitis. What other differential diagnosis can have?
Problem two, biliary system, if there any cholecystitis or if there any biliary stones.
All
If
right. So
there
what investigation you need to do to confirm it is acute pancreatitis?
general blood basic investigation.
And no, what is more? No. What is the investigation? Confirm diagnosis. I don't ask you in general.
Yes.
What is
Yes.
confirm diagnosis?
Definitive investigation will be serum amylase test and serum lipase test.
Amylase and lipase. Of course, we will did baseline investigation. What is the baseline investigation? Suppose now amylase is elevated. So what other baseline investigation you need to ask?
I will full blood count for the patient, UNEs, liver function test, and inflammatory markers, and the measure blood sugar, and also EBG, and check serum calcium level of the patient.
Okay.
Also, I can
Your answer, doctor, is your answer is correct, but I don't give you good mark. You know why?
why?
Because if you mention full blood count, what you looking in full blood count?
Yes, I will look for white blood cells and the hemoglobin level of the patient, and also
Okay, so no,
hematocrit.
in general, you don't be either you don't mention something or mention all. In this patient in particular, what you're looking for, you're looking for leukocytosis. Acute pancreatitis not cause anemia, maybe associating anemia, no problem. So full blood count for leukocytosis and anemia. What else? You ask about calcium. Why you ask about calcium?
Because the patient with pancreatitis has disturbances in his electrolyte, especially in calcium.
No, doctor. This way in exam is not good. So just one word. Why you ask about calcium? Because calcium is becoming.
Saponification of calcium.
No, make it more easier. The calcium become high or low?
Yes, low.
Low. So just tell low. Okay, so just because the calcium will become low, if you need to ask about the cause, we ask you about the cause. All right, okay.
Right.
Tumor marker, okay, maybe not necessary. What else you will ask? What is the other radiological investigation?
Abdominal ultrasound and CT scan. Also, I can go
CT
with
scan for the
X-ray
abdomen.
for the abdomen.
Say again, what is the value of X-ray?
To see if there any air under diaphragm.
All
or
right.
not.
Okay. So what you expected if you mention this sentence in the exam? What is expected the response in the examiner?
Actually, I don't know, Dr. Sheen. You can
All
give me
right. Okay. I tell you, I give you minus in professional because this is patient is already diagnosed as from history and everything is acute pancreatitis. So we don't make X-ray to exclude because it is not a vague abdominal pain and they need to exclude other. But you can write in simple way. I will ask for chest X-ray in the same time to see the chest, any chest infection, and in the same time I can see air under diaphragm. Okay. because
Okay.
it is just to confirm it is not perforated viscous. Okay, no problem. After that, what is the common etiology in this patient? Common etiology of acute pancreatitis in general, not in this patient.
In general, maybe after any surgery, idiopathic, maybe
No,
gallstone area.
doctor, relax, relax. If you ask what is the common cause of acute pancreatitis in
Alcohol.
your country,
Alcohol is
what
the
is,
one. In
no,
my
no,
country,
relax,
it's
doctor.
gallstone.
Okay, even in England, okay, we don't ask you to enumerate. If you are, this is exam is not for enumeration. So what is the, usually in the exam, we have about 20 questions. You need to answer it less than 10 minutes. So this is about 60 questions you need to answer in 3 minutes. So what is the common cause of acute pancreatitis in all over the world? What is your answer?
It's gallbladder stone
G-
and alcohol.
Gallbladder stone and then alcohol. Okay. Nowadays, also the common cause can be post any surgical or any procedure can be complicated by acute
Operation.
pancreatitis. Any
Yes,
procedures
when
can
we have
what
yes
say
after
again?
ERCB.
After ARCB. Okay. So this is the commonest. Of course, pancreatitis can be idiopathic, can be due to hyperlipidemia, hypertriglycerides, it can be due to many causes, but the common cause is still, even in England, is gallbladder stone and the stone jump to common bile duct and the pancreatic duct, alcohol, and post ERCB if the patient don't take prophylaxis antibiotic. Okay. So how to treat this patient?
I will start with analgesia for the patient to relieve pain and give the patient O2 mask. Also keep the patient MBO. I can accept
What
also
is
nasogastric
NBO mean?
tube.
What is NBO mean?
No, Nelber mouse. No,
Okay,
no
all right,
oral.
okay, all right,
Never oral.
okay, okay.
Yes.
So why you give
Also,
oxygen? To prevent
I will give
what
the
is the
patient.
complication can happen in the lung if the patient have acute pancreatitis? What is the worst scenario happened in the lung?
The worst scenario is acute respiratory distress syndrome or
Okay,
acute lung failure.
ARDS. So this is why we prefer to give oxygen. We prefer to give also fluid to avoid what we called it a acute kidney injury. Okay. Of course, we start by analgesic. We can admit it in ICU, put a catheter, fluid chart, and give oxygen. Don't forget to do that. Okay, so back to you again. So any comment? Thank you, doctor. Any comment from other? I think many elevated their hand. Is any comment? Any question?
No, just I need to join with you, Dr. Shireen.
Okay, so we can start. What's your name? You are?
Ahmed Fathi, Doctor.
Ahmed Fathi. Okay, so Ahmed Fathi. All right. So as you see, this is simple stations. It takes 6 minutes. After 6 minutes, you have question. Usually the question, what is your differential diagnosis? What is the investigation? And how to treatment? Just in simple way. Don't waste your time for unnecessary investigation or unnecessary condition. History taken is easy station, although many fail on it. Okay.
Okay.
After that, we have another case. So, Dr. Fathi, I think you see the screen or not?
Yes, Doctor.
So, it is 45 years old woman, complain of yellowish discoloration of sclera of her eye and abdominal pain. Take a history from her.
Okay.
Okay, so
Uh,
now, okay, we just count the time. All right, you can start.
Hello, I am Dr. Ahmed Fathi, one of surgical doctor. Can I confirm your name and your age, please?
Yeah, I am Anne Mary. I am 45 years old.
Can I call you Anne?
Can, no problem.
Okay, nice to meet you, Anne. Today I have been asked to ask you some questions related to your condition. Is that okay for you?
You can ask.
Okay, I see that you come today complaining from some tummy pain and yellowish discoloration. Is that true?
Yes.
Okay, I'm really sorry for your tummy pain. Must be frustrating. Do you need any painkiller?
No, actually, doctor, it is not frustrated me.
Okay.
Okay.
Okay. I am happy for that. for sure.
No,
Okay.
no. Okay, all right.
Can you tell me
Okay.
more about your condition, please?
You can ask doctor, I tell you.
Okay. Regarding your pain, when did it start?
It is the start when I was invited for a lunch. So when I eat, I have this severe abdominal pain.
Okay, I'm sorry for that. Could you tell me where this pain exactly?
It is in the right upper part of my abdomen.
Okay. Does anything make this pain increase in intensity?
When I eat when I try to eat again, I found the same pain again.
Okay. Does anything make it better, like doing some movement or anything else?
No movement become worse, eating become worse. Nothing, just lie down, they become better. And in the hospital here, they give me antispasmodic. I become okay.
Okay, I'm happy for you. I can sure, sure. Could you tell me what could you describe this pain for me? For me, is dull aching or sharp or colicky pain?
Yeah, it is intermittent pain. So I think intermittent mean colicky.
Okay. Could you tell me scoring of this pain from 1 to 10 as 1 is the lowest and 10 is highest?
Yeah, I think it is was 7, and now because I take medication become 3.
Okay, I'm happy for you. Could you tell me, do you notice any itching in your body?
Uh, yes, I noticed that in the morning.
Okay. Could you tell me, is your pain moved to your right shoulder?
Yes, it is radiated to my right shoulder.
Okay. Could you tell me, do you have any color changes in your urine or your stool?
In my urine, yes, it has become tea color or dark color. Stools, I don't notice that.
Okay, I'm happy for you. Could you tell me, do you notice any unintentional weight loss?
No.
Do you have a night fever?
Night fever. No.
Yes. Do you have losing in your appetite?
Loss of appetite. No.
Okay. Could you tell me, do you have any disturbance in your bowel habits, like constipation or diarrhea?
Diarrhea. No.
Do you have any muscle pain or joint pain?
No.
Do you have any redness or pain in your eye?
No.
Okay. Could you tell me, do you have a chest pain along with your tummy pain?
No.
Do you have a shortness on your piece?
No.
Do you feel aware of your heartbeat?
No.
Okay. Could you tell me, Anne, do you undergo any previous surgical operation?
No.
Do you have any other medical condition like diabetes or increasing in your blood pressure?
Diabetes. No. Hypertension. No.
Okay. Do you have any history of hypercholesteremia?
No.
Okay. Do you experience this episode before?
No. First time.
Okay. Could you tell me, do you take any medication?
No medication.
Do you have any allergy against any drug like
No,
penicillin?
actually, I allergic to seafood, but not to medication.
Okay, okay, and
So you
thank
ask
you.
about allergy to medication and food. Okay.
Okay. Do you is anyone of your family have a similar condition?
No, but I think my grandmother died from cancer head of pancreas.
I am really sorry for that, and I am please
Okay.
my sincere condolences. Okay, could you can I ask you some personal question?
Well, can. No problem.
Okay, what are you doing to live?
No, I am housewife.
Okay, do you live with your husband or alone?
No, I live with my husband, with my
Oh,
family.
for you. Could you tell me, do you smoke?
Yes, I smoke 5 cigarettes per day for the last 20 years.
Okay. Do you drink alcohol?
Yes, I drink 1 can of alcoholic beer every weekend.
Okay. Could you tell me, do you have any problem in your urination or any problem in your passing stool?
No,
Okay. Do you have any feeling aware of your heartbeat?
no,
Okay. To summarize what you told me, you mentioned that you have an right upper abdominal pain, which moving to your shoulder and increasing by acquiring a fatty meal. Also, you mentioned that you mentioned color changes in your urine. Also, You mentioned that you smoke 5 cigarettes per day and you drink alcohol 1 can every weekend. Also mentioned that you are allergic from seafood and your grandma died from cancer of pancreas. Is that true?
Yes, I just need to add, I have fever, by the way. You ask about night fever, so you disturb me, but I have a fever. It is not
Oh,
night, it is fever in the morning.
okay.
Okay?
Thank you
All
for mentioning.
right.
And do you
Okay.
need to? Do you need? I'm going to ask to discuss my finding with my senior, and I will come back to you as soon as possible. Okay?
All right. Okay. We take 6 minutes is okay. Doctor, what's your name?
Ahmed
Ahmed,
Fat.
Ahmed Fathi. Dr. Ahmed, is your knowledge is okay. But I just ask you some question. You tell the patient, I am happy for time. Okay. So this is if even translate your language or English language, if the patient say, I am not have loss of weight, so why you are happy? If you ask me, you tell I am happy for you 4 times or 5 times. So why you tell that?
يعني in a first time or second time it doesn't relate it, but in oh, okay, the fourth time doesn't relate it to anything.
Okay, is it we don't say the patient I am happy for you, or is this okay? If the patient, for example, have no cancer or no loss of weight or something, you are not happy. It is good to know that, nice to know that. Don't speak, no problem, but it is not make you happy. It is something like sometimes in exam we tell the student we have a patient and have car accident, so the student say okay, well, good. So it is not well and not good, but it is if it is good news, it is good, but it is not make you happy. So it is not affect your mark in knowledge, but can affect your professionalism. Okay.
Okay, Dr. Shireen, I'm sorry
All
for that.
right. This is first. Second, you ask about muscle pain, eye redness. What is the value to ask about eye redness?
To exclude IBD, inflammatory bowel disease.
Okay, but why you expected this patient have inflammatory bowel disease and what is the relation between red eye? I think it is not related to our condition. The same for why you ask about night fever.
To exclude any to exclude
TB, for example, or what?
uh,
I don't understand you, but
constitutional symptom related to cancer or something like this.
are you know that we diagnose cancer by night sweating? It is
No,
in some countries they diagnose it by TB can be diagnosed by night sweating, but
yeah, yeah.
not here.
I
Okay.
I I uh, I mean that night sweating, but it's I said night
Okay.
fever, night sweating for
Night fever or night sweating, whatever is not related. The same eye redness and the muscle pain. Also, why you ask about muscle pain in patient have most probably gallbladder.
extra intestinal manifestation of IBD, but you mentioned that Dr. Shireen it's not related. I'm
Okay,
sorry.
it is important don't to be so clever.
Okay.
Okay, you are okay. You don't ask about ministerial history. It is important, not related to the condition, because when decided the time of operation, usually we avoid the time of ministerial period. This is a clinical practice in the general surgery, especially in elective operation. So usually the nurses ask the patient, we give you appointment after 1 month. Is this time of your ministerial periods? If she say it is yes, so we can postpone. All right. In the beginning, you, Mister, it is very frustrated you and all this. You consider it is some sort of empathy.
Yes.
Okay. So, if all right. Okay. You see, okay, no problem. Okay, so
Uh,
just to make it in simple way, but it's okay.
how to
Just someone asked about the summary. A summary nowadays usually we present it sometimes to the patient, sometimes to the examiner. It is according to what is written in the scenario outdoor, because some station is just a simple station, don't take a time, so we try to make something like this. Okay. Someone asked about is LDH is important for for acute pancreatitis, yes, it is important, and one of the investigation usually you ask about it. But of course, amylase and lipase is the best one. All right, so back to you, Dr. Fathi, what's your diagnosis?
I should consider pleurocholic or acute cholecystitis.
Dr. Fathi, if you are enter the exam in this attitude, it is easy to fail. You know, we have a term in the exam is easy to fail and easy to pass. Okay?
Okay.
So we say in the history taking, you say the patient have fever. I insisted to tell you they have fever, they have jaundice, and they have pain. So what's your diagnosis?
Acute cholangitis.
Acute cholangitis. So can be acute cholangitis. If this patient have no jaundice, can be acute cholecystitis. So what investigation you need to do for this patient?
Abdominal ultrasound and liver
No,
function.
doctor. Start first by lab investigation. So I start by full blood count and all this. Full blood count looking for leukocytosis and what else? Go on. What else you need to ask? What else you need to be investigated? So you ask about full blood count and liver function test looking for what?
AST and ALT.
Yes, but what is the important to know that this patient jaundice can be medical, can be surgical, so which you need to ask. Bilirubin, which bilirubin is high?
Unconjugated conjugated bilirubin.
Conjugated or direct bilirubin is high. After that, baseline investigation, other baseline investigation, and after that, as you mentioned before, it is what you need, radiological or in imaging.
Ultrasounds.
Abdominal ultrasound, looking for
stone in common bile duct or dilatation.
Okay, you're looking for the thickness of the gallbladder, you're looking for any stone inside the gallbladder with acoustic shadow, and also looking for the size of the common bile duct. What is the size of the common bile duct usually?
I don't know.
No, it is usually 6 to 7 milli, and become dilated, it become 1 centimeter or 10 milli. Okay, if this patient have obstructive jaundice, and this is obstructive jaundice can cause him due to stone in the common bile duct, how to manage?
If the patient is symptomatic, I can go for laparoscopic cholecystectomy.
No,
If the
doctor,
patient...
relax. If the patient have jaundice, you need to relieve jaundice first. Laparoscopic cholecystectomy is done later after 6 weeks. But now the patient have a stone in common bile duct and the patient is jaundice. So how to manage?
Remove the stone by ARCB.
So
if not, if it, I will put a stent to as a method of temporary drainage.
Drainage. Okay, so we start by endoscopic retrograde cholangiopancreatography and try to remove the stone or put a stent, or remove the stone and put the stent. And after 6 weeks, in some centers we remove by laparoscopic cholecystectomy. In some centers they make it early, but usually all over the world they prefer 6 weeks. Okay. I think that is all from me. Any comment from the other? Anyone need to comment? Okay. Apart from you ask many other questions, but it is easy, the simple topics. Okay, it is important to know the difference between acute cholecystitis, which has no jaundice, and ascending or acute cholangitis, which has triad, what we called it Charcot triad, which is fever, jaundice, and yellow discoloration. Okay. The third scenario also abdominal pain. So who's need to share? I think we have many, 1, 2, 3, 4. I have 4 scenarios, so don't worry. We can start by Muhammad Ragab, for example. Are you here? Muhammad Ragab, Muhammad.
Yes, I am.
Okay, so we start by you. The others will be after that. So we have a 35 years old. You see the screen. Woman complain of
Yes.
abdominal pain, bloody diarrhea. Her husband left his job and she had some financial problem. Okay?
Yalla, let's start.
All right. You can start.
Good afternoon. My name is Dr. Muhammad Rayab. I'm a surgical doctor here. Could I confirm your
Yes.
name and your age, please?
Yeah, I am Miss Anne Mary and I am 35 years old.
Nice to meet you, Miss Anne. Today I have been asked to ask you some question regarding your condition. Is it okay with you?
Yes, can. Okay.
So could you tell me what seems to be your problem today exactly?
I have abdominal pain for many years. I think now it is more than 10 years. Every now and then I have severe abdominal pain.
I'm very sorry to hear that. Is that pain started gradually or started suddenly?
No, it starts gradually, become severe, after that decrease. So it is for long time I have this pain.
Where is the exact site of that pain?
It is all my abdomen. It's not exact site. It's all over my abdomen.
Yes. What is the character of the pain?
It is sometimes colicky, sometimes dull aching.
Yes, I understand. Does the pain increase by time or decrease by time?
No, it is decreased by time. After I stop eating and everything, so it decrease.
Yes. Does anything make you feel worse? Was this pain worse?
No, nothing make it worse, nothing make it decrease, except if I take painkiller or antispasmodic.
Okay. Could you score the pain out of 10, which 0 is the lowest and 10 is the highest?
Sometimes 3, sometimes 7.
Yes. Do you feel that pain into anywhere else into your body, or radiated into anywhere into your body?
Sometimes I have joint pain and muscle pain.
Yes, I understand. Is that pain relieved with medication?
Yes, but came again. So it is, I have this condition for long time.
Okay, I understand. Do you have any fever?
No fever.
Any weight loss?
No weight loss, but I don't get much weight because I have continuous diarrhea many times in the year. So usually I have diarrhea, but no much weight loss.
Yes. Is this diarrhea watery diarrhea or contain blood?
No, it is sometimes a bloody stool and sometimes is just a diarrhea.
How many motions per day you use?
In time of diarrhea, I have maybe 5 times per day.
Yes, yes, I understand. Do you have a change in your bowel habits?
No.
Okay.
You mean
Do
alter
you
bowel
have?
habit like constipation and diarrhea? You mean that?
Yes. Yes.
No, no,
Okay. Do you have any pain during defecation or passing stool?
no.
Okay. Do you have? You mentioned you have some joint and muscle pain. Yes.
Yes, I have
Any problem
sometimes
during?
muscle pain and joint pain. And I ask, I go
Yes.
to
Do you
GP and he said it is maybe related to my condition.
Yes, yes. Do you have any problem into your skin or eyes, dryness into your eyes, or change
I have some
color?
redness in my eye. I think the doctor diagnosed as iridocyclitis or inflammation of some part of eye. What is the next question is eye and
Is
skin. Yes,
and skin.
sometimes I have some skin color change.
Do you have bleeding from anywhere else into your body?
No,
Other bleeding from mouth? From yes.
no,
Okay.
no.
Do you experience before any longest constipation?
Long standing what?
Constipation.
No,
Okay. Do you have vomiting of blood before?
no.
Okay. Do you have any other medical condition like diabetes or cholesterol
No,
or
no, no,
immunological
no
disease?
other medical condition except this problem and some muscle pain and joint pain.
Do you took any medication?
For that, I will tell you later. Okay. For that or
Right,
for
okay.
other disease? For this
For other
condition
disease.
or for other disease? No, I don't take
For
any
other-
medication for other disease.
Do you have any allergy to medication or allergy to food? No, an allergy?
No, I'm allergic to seafood.
Okay. Do you took any blood thinners?
No,
Okay. Do you have any surgery before?
no, sir.
Any admission to the hospital?
Yeah, I admitted many times for this condition.
Yes. Do you have, Mrs. Annie, do you have, what's your job, please?
No, I am a housewife because this is condition affect my performance, so I stay at home.
Yes, I understand. Whom is you live?
I with my husband and 2 children.
Okay. Do you smoke?
Yes, in the past, but now I stopped smoking. I was smoking 5 cigarettes for the last, maybe I stopped it 10 years ago.
Okay. Do you drink alcohol?
Now also just occasionally in weekend.
Okay. Does anyone from your family has a condition similar to your condition today?
Yeah, yes, my young sister have the same condition and takes the same treatment.
Okay. Do you have any headache?
No,
Any chest pain?
no,
Any problem? Any problem with your heartbeats or irregularity in your heartbeats or feel aware?
no.
Okay, Mrs. Annie. Let me summarize to you your case in brief, please. You have
Yes.
abdominal pain started years ago, started gradually all over the abdomen, colicky and dull aching sometimes, associated with joint pain and muscle pain, and also associated with diarrhea, sometimes bloody diarrhea and sometimes normal diarrhea, about 5 motions per day, and associated also with eye problems, scleritis or uveitis. Also, you smoke, but ceased to smoke 10 years ago. And drink alcohol, and you have a positive family history. Your sister has a condition similar to your condition today.
Okay.
Anything else you want to add to me?
No, thank you. Okay,
Okay,
doctor, what's your name again?
Muhammad Ragab.
Dr. Muhammad, you are okay, but we have, for the knowledge, no problem, but we have something called social intelligence. What is social intelligence? If the patient say to you, I admitted many times for this condition. So what you expected to ask here?
I should ask about this admission. Is it passed without problem? How many days?
No, relax. No. We don't take detail about admission. We are not in the manager of the hospital, but at least to what is done. So I tell you, at time of admission, I did endoscope. So what is the diagnosis of this endoscope? Okay, either the patient tell you, or usually we tell the patient, the doctor show you the picture, and you can tell me the diagnosis. So suppose you ask. So I admit it and I have endoscope and this is the picture. Okay, I make it bigger. All right.
Yes.
So what's your diagnosis?
It's a irritable bowel disease in the form of.
No, doctor, irritable bowel disease is diagnosis given if the patient have nothing. What you mean by irritable bowel? I think you missed the diagnosis. What is your diagnosis?
My diagnosis
From the
is,
history, what's your diagnosis?
as I mentioned, is irritable bowel disease.
No, doctor, you mean that IBD? What is abbreviation of irritable bowel disease? What is IBD?
Is irritable bowel disease.
No, IBD is not irritable bowel disease, doctor. Anyone can correct it to him.
Inflammatory bowel disease.
Doctor, inflammatory bowel disease is different than irritable bowel. Irritable bowel, if I don't found any diagnosis, I say it is irritable bowel or irritable colitis or whatever. But
Yes,
what we mention is inflammatory bowel disease, IBD. Inflammatory bowel disease can be Crohn's or can be what is called ulcerative colitis. Okay, so they have some marker like C-reactive protein, fecal calprotein, or calpoprotein or calpoproctin, or of course we did colonoscope. We can see. Okay. This is picture, by the way, you see it. It is ulcer, so it is ulcerative colitis most probably. And this is the gross anatomy in Crohn's disease with escape lesion and transmural affect all layer of the skin. And this is the colonoscopic picture of the ulcerative colitis. And this is a picture of also of ulcerative colitis. So either Crohn's, make it Crohn's is easy. So why you says it is Crohn's disease or inflammatory bowel disease from the history? Because of
long-standing abdominal pain associated with bloody diarrhea and associated with extraintestinal manifestation of IBD, and also positive family history of the same.
All right, okay. So what is the common problem can affected in inflammatory bowel disease, especially the spinal cord? not the vertebral column. What is the disease can happen? What we called it?
Vertebral column was yes, ankylosing spondylitis. Yes.
Okay. What is look like? Or
The
sacroiliitis? What is look like? In X-ray, for example.
I think
It is like bamboo shape appearance.
bamboo
Okay.
shape, yes, bamboo shape
All
appearance,
right.
yes.
So the second common question we ask you, and is important in exam, in the orthopedic station of the spine, how to diagnose it?
By the marker, which is HALA B27, and doing inflammatory markers also. Most important
No, doctor, relax. What is the physical examination you can do to diagnose ankylosing spondylitis?
Yes, I can do Thomas test.
Not Thomas. Schubert test. Like
Schubert.
remember that Schubert is a Shubra is a district in Egypt.
Yes, I understand.
Okay. So Schubert test is asking the patient to leaning forward and the increase. So this is why measurement in spinal examination is important in UK, because ankylosing spondylitis is common. In other country or some country, it is not common, so they don't do the Schubert test. Okay. Thank you. Someone asked, is history is a station of communication skill? No, it is not communication skills. In exam, we have 2 stations in history taking. I just show you the distribution of the question, and it is important to know that this is the distribution of the station. You see the screen now or need to share? You see it? Okay, all right, okay. So I will share. So it is important to know history taking is one of the 2 stations of history taking. I just make it bigger. So again, so history taking, yes, it is under communication. Yes, history taking is 2 station is history taking. But you can see we have 4 for clinical, 8 for clinical and technical, and 4 communication and 4 professionalism. Okay, so this is under all this under clinical and surgical skills, and the communication skill is one item, 8 stations out of 160. Okay. All right.
ماشي، عندي
Yes.
عندي
You can ask.
الحته دي كنت
قول.
في الاناليسيس بتاع البلاد دايريه، احنا بنتكلم عن البلاد، قلنا اذا كانت هي الكلر بتاعها والكلوتس والاماونت والبين، صح؟
ممكن، بس هي طبعا هي باينه في الاول ان احنا speak about Crohn's او inflammatory bowel disease. ما انا يعني I don't insist it to be in detail, but if this patient is colorectal cancers, you need to ask about it is fresh blood or altered blood, because fresh blood and painless can be due to cancer in the lower rectum and the anus. If it is patient have painful fresh blood, so it is hemorrhoid. So this is usually it is fresh blood in the stool, but the term usually bloody diarrhea means that it is blood mixed with the stool due to shedding of mucosa. So you can ask. It's better to ask, by the way. Okay.
بيبقى سايت اونس كاركتر راديشن وتايمينج وانكريز باي decrease باي وسيفيريتي، رايت كده؟
No, not so much. Just in simple way. It is big amount have blood clots. It is fresh blood or mixed with stool, or it is blood or not blood. Usually the patient say it is not a blood. It is like dark color or bloody, but not. I don't see fresh blood.
اوكي تمام، شكرا.
Okay. Usually history taken is easy station, although the many students fail on it because they take it in the complicated way, and they have impressions that we need to mention all differential diagnosis and all the other. Okay, I think Dr. Zahra, you share or you need to share?
عايزة share.
Okay, so you can start also. We have a lot of stations, so I share with you. So, okay.
دكتور لو حضرتك تسمح لي عندي سؤال سريع.
You can, no problem.
احنا do we have to summarize for the patient؟ حضرتك قلت if it's mentioned in the stem we can summarize for the patient. بس يعني I
Okay.
noticed in the other candidates they did not ask about the idea and the concern of the patient. I think إن دي حاجة مهمة، بس طبعا حضرتك يعني please correct me.
What's your name, doctor?
أنا اسمي إسماعيل.
Ismail. So, Dr. Ismail, next station you can go that and tell me about ICE, and I tell you what is the response of the actor. Okay? Or
ماشي
even
تمام.
doctor who okay, we pick it for the next, so just ask, or even doctor now you can ask at the end about ICE, and I tell you what is the professional actor response. Okay?
Okay,
All right.
thank you.
You know, by the way, the actor is different from country to country. In Saudi Arabia and Abu Dhabi or United Arab Emirates, they have professional actor. Professional actor is the actor that, like in movies, like third class actors. It's the same in some country like Southeast Asia. In Egypt, we don't have professional actor. We have some medical student or doctor. But I give you the response of the professional actor. So, okay, you can start now. So, doctor, I am 65 years old, the old man, seen in outpatient clinic, complain of intermittent pain in the left lower limb after walking.
Okay.
Okay, so you can start if you wish.
Okay. Good afternoon. I am Dr. Mahmoud, one of the surgical doctor here. May I
Yes.
confirm your name and age, please?
Yeah, I am Mr. Richard, and I am 65 years old.
Nice to meet you, Mr. Richard. How can I help you today?
No, actually, I have pain when I walking, and this is pain is disturbed my walking because I usually used to walk about 2 kilo every day.
I really sorry to hear that. It seems a very stressful condition for you. Before we start, do you mind if I take some notes while I'm talking to you?
You can, no problem.
Okay. Can I ask you some questions regarding your condition, if you don't mind?
Can, no problem.
Okay, Mr. Richard. Can you tell me when the condition started?
Just 1 week ago, I usually used to walking about 2 kilo per day. So nowadays, I found it is difficult after I walk about half the way. I found severe pain in my left leg, and this is stopped me to walking for 5 minutes. After that, I walk again.
I'm really sorry to hear that. So it's gradual in onset. Okay. Is
Can.
is it right?
Yes. Okay.
Okay. Where is the exact site of the pain in your
It is in the
which leg?
left leg.
Okay. Does the pain goes anywhere else?
No, not radiation.
Okay. What increased your pain?
Just if I insisted to walk again.
Okay. What is relieve your pain?
Just to stop walking for 5 minutes.
Okay. If I give you score from 1 to 10, 1 being the lowest and 10 being the highest, can
Yes.
you rate your pain?
It is 5.
Okay. Regarding your pain, can it's relieved by any medication or just rest?
No, I just stop walking for 5 minutes, so improve, but I can walk again. But after that, if it's still walking, they have the pain, I need to stop 5 minutes again.
Okay. What is the type of, can you describe the character of your pain, please?
It is cramping pain.
Okay. Just more questions, if you don't mind, Mr. Richard.
Okay.
Okay. Do you feel any numbness or coldness in your leg?
One by one. So coldness, yes, I feel it is more cold than the other. You mean sensation? I think this is little impaired sensation in the left in comparison to the right side.
Okay, thank you for sharing this information with me. Can I? Do you have any trauma to your back?
No.
Okay. Any weakness in your lower limb?
What you mean by weakness? It is weakness in muscle. You mean that weakness muscle?
Weakness in muscle.
You know how come I walking 2 kilo every day, so how become have weakness?
Okay. Do you have any swelling or redness in your cup muscles?
No,
Okay. Do you have any numbing in your private area?
no.
Okay. Some more questions regarding your condition, Mr. Richard.
Okay.
Do you smoke?
Yes, I smoke 20 cigarettes for the last 50 years.
Do you
Every
drink
day.
alcohol?
Yes, I drink 1 can of alcoholic beer every day.
Okay. Have you ever hospitalized before?
No, but just to go to GP.
Okay. Have you ever been diagnosed with a medical condition like diabetes or hypertension?
Yes, doctor, it is better if I go to GP. So why you go to GP? But it's okay
Okay.
because I have hypertension, I have diabetes.
have
I take medication of hypertension. Sorry, no diabetes, but I have high cholesterol. But I don't take medication for that.
Okay. Do you have any allergies to drugs or foods?
I am allergic to seafood.
Okay. What is your job, Mr. Richard?
I am retired teacher.
Okay. With whom do you live?
No, my wife is with my wife. Yes.
Okay.
Mhm.
What is the level of your activity?
No, it is normal. I walking every day 2 kilos, so I active. I am active.
Okay. Does anyone in your family has a similar condition like this?
No, but I think my father died from heart attack.
I'm really sorry for your loss. With my sincere condolences. I'm
Okay,
sorry
thank
for
you.
your loss.
Okay.
Okay. Just to summarize, thank you for sharing this information with me. I will discuss with my consultant about your condition, and I
Okay.
will come back to you with the feedback.
All right.
Um,
So I think we leave ICE to Dr. Ismail for the next station. No problem.
can I summarize?
No. Leave it to him. Okay. So, doctor, I think you missed something important. What is your diagnosis?
Lower limb claudications, vascular
Okay. So
claudication.
if it is lower limb claudication, if you inspect the patient or you examine the patient, what you
Loss of
looking
hair.
for? Okay.
Loss
So
of
you can
hair.
see the screen. You see the
لا
screen.
ما بصيتش بس افتكرت على
Okay,
مصر.
so you need to ask, this is from the beginning is look like ischemia or claudication pain or intermittent claudication. So you need to ask about loss of hair, skin change, wound or ulcer, infection between toes. Of course, you mentioned intermittent claudication pain. I mentioned to you. You ask about the muscles, okay. You ask about sensation. You ask about temperature. But it is important because what happened usually the first manifestation is a skin manifestation. Although you take a good history and you may be good mark, but you lost many mark in professional because you're not good observer for that. Second thing also you need to be good observer. If I say you again, I admitted to hospital, I go to GP. So why you go to GP? Because I'm a hypertensive, I am diabetic, I take a medication. I tell you that I take a medication, but I don't speak about cholesterol. I don't take a medication for cholesterol. This is why I have all this trouble. So what is your
انا
diagnosis now? What is your diagnosis?
انا فهمت ان حضرتك عدلت ان حضرتك قلت لي لا انا ما خدتش ادويه تاني، فانا عشان كده ما سالتش عن نوع الادويه، فانا
لا,
فهمت
I
غلط.
don't take the medication. I mean that I have the disease. I took the medication. So this is why I have the complication now. So what's
اوكي.
your diagnosis? I think you ask about other system or you forget.
Like other system
Like
اللي هو
shorting of breath and chest pain and
نسيت.
urine and stool. You forget it.
نسيت.
Okay, you know how mark this in exam is 2 mark. And this is very common to best my students. They concentrate on the what is the main issue and forget all this. So it is important. Don't forget to ask about other system. Okay, you know that for many years, we have a lot of the students failed in this station because they concentrate of the main disease. They forget to ask about social history, family history, allergy, and the other system. If you count 1, 1, 1, and 2, 2 for other system, it is about 6 mark. So 6 mark gone for nothing. Okay, so this is left ischemia. You can
عايز
ask.
اسال حضرتك
Yes.
بخصوص الجي بي، انا ما ردتش لان انا ما كنتش اعرف ان انا المفروض اما حضرتك تقول لي الجي بي مثلا ان انا اقول ان انا مثلا هقول انت رحت للجي بي ليه، فكويس ان حضرتك
No, it is important. For example, if I say in this inflammatory bowel disease, I admitted to hospital. So why you admitted? They do colonoscopy. At least if you don't forget, so you know that colonoscope is one of the investigation. Okay, so that usually most of the answer of the question you can take it from the patient himself. Okay, so what is the investigation you will did? Okay, you can ask.
بخصوص الاذر سيستم ينفع في الاخر لو حتى ايفن انا خلصت وعندي وقت ان انا ارجع تاني اساله، يعني اخد السيستم من فوق مثلا اذا كان عندك
Okay, you can ask within 6 minutes you can ask, no problem. If you have a time you can ask.
افتكرت حاجه بعد
You can ask, no problem. No problem. Professionalism is another mark, no problem. But at least you take the mark for this or 2 mark for this. If you ask anything, whatever the order, you take a mark. Okay. Of course, what investigation you will do? Baseline investigation and
baseline investigation، وهنعمل طبعا هو حضرتك قلت لي هايبر ليبيديميا يبقى ليبيد بروفايل
lipid profile وكوليسترول low density, high density, all this. After that, CT angio, of course, Doppler, duplex. Of course, in examination, I can did ankle brachial index. All this must be done. Okay. If you have this patient picture like this, again, what is your diagnosis? How to manage?
The popliteal artery block.
Okay, so how to manage this case? But this patient is good. Why is good? Because have good collateral. This is our patient. He have good collateral, so he's not dead limb. How to manage?
Stent يعني
No, doctor, relax. This is obstruction. You need to remove the obstruction by embolectomy. After that, balloon dilatation. After that, put a stent. Don't jump. How to put a stent and have thrombus? It can done only in aorta. Big artery can be expanded. But in a small artery, it's better to do embolectomy or thrombectomy or whatever you need before that. Okay? All right. So now I think Dr. Ismail, who we asked about ICE, so he can ask about ICE.
طب معلش يا دكتور شيرين، معلش سؤال تاني يبقى بخصوص السمري عشان انا التليفون خرج اما حضرتك.
All right. Okay. The summary is according to what is written in instruction. Because some students, they complain that they don't understand our English. So we ask the actor to ask him, so he summarized to the actor. So sometimes you summarize to the actor, sometimes you summarize to the examiner. So I think you can start to summarize to the actor. If he say, okay, the examiner ask you, okay, can you summarize to me? No problem. So you need to summarize whatever. In one station nowadays, in some country, all the station, even the question is asked by the patient, not by the examiner. Because in some country, they say we don't know the examiner with Indian accent, and some countries they say we don't understand the examiner with Middle East accent. So this is different from center to center.
Okay.
All right. Okay, Dr. Ismail, are you general surgery or what is your specialty first?
Yes, sir. I'm general and laparoscopic surgery. I'm at senior level.
All right. So which country you are from?
No, Masri.
Masri. Okay. So which hospital you work?
I work in Dar Fuad, October.
All right. So it is good. So we can know what you did there. So you see the screen. So it is 65 years old man attend in outpatient clinic, complaint from altered bowel habit. Okay. So easy scenario. Okay. We can start.
Okay, sir. Good afternoon, sir. This is Dr. Ismail Abougendi. I'm one of the surgical team.
Yes.
So can I confirm your name and age, please?
Yes, I am Mr. Charles. I'm 65 years old.
It's nice meeting you, Mr. Charles. So, sir, before we begin our consultation, do you mind if I take some notes while we have this conversation?
You can, no problem.
Okay, let's start with what brought you here today to the outpatient clinics.
Yeah, I just in the last 2 months I have alternation between diarrhea and constipation for the last 2 months.
I'm really sorry, it must have been difficult for you, Mr. Charles. So
Okay.
can you tell me more about your condition?
So the constipation, I can take one day, no, don't go to toilet or washroom, and sometimes in other day I went to 5 times.
So one day it's
Yeah,
constipation
so
and you
it's
don't know.
alternative, not one day.
Mhm.
So 1 week constipation, 1 week or 2 weeks diarrhea. So it's alternative or alternated diarrhea and the constipation.
Okay, Mr. Charles. So when did this start?
No, last 2 months.
For the last 2 months. Oh, I'm really sorry.
Yes.
It must have been difficult for you. So I'm reassuring you,
Mm.
Mr. Charles, we'll do everything we can to help you. I'll just need to ask you a few questions. So
Yeah.
regarding this condition, can you tell me how many motions per day?
Normally it is 2, but if you have the attack recently, I went to sometimes 5 times per day, and other time just one every 2 days.
Okay, and this condition, is it the first time you experienced this, or did you
Yes,
have this
just
condition
the
before?
last 2 months.
Just the last 2 months. Okay. So have you noticed anything that relieves this constipation or helps with the diarrhea?
No,
Nothing makes it better. Anything makes it worse.
nothing goes. It is just sometimes like this, sometimes like this.
Okay, so is it associated with any tummy pain?
No abdominal pain.
Okay, is it associated with any high temperature or fever?
No fever.
Okay, so back to the diarrhea. Have you noticed that it like stained with blood, mixed
Yes,
with blood or mucus?
I have blood, and this is blood is mixed with the stool, so the urine, the stool color is dark in color.
Oh, okay, so it's not fresh red, like red,
No,
bright
not
red
fresh
in
blood.
color.
It is dark blood.
Okay, very well. And is there also mucus with the stool or just the blood?
I don't know. I don't notice that, but I just see the color.
Okay, no problem. So I need just to ask you a few other questions regarding your back passage. Do you feel any pain while defecation?
No pain.
Okay, very good. And do you have like any swelling while
No
defecation,
swelling.
Mr.
No
Charles?
swelling. No swelling.
Okay, that's quite reassuring for me. Okay, so Mr. Charles, do you get like any night sweats,
No.
any lumps and bumps anywhere in your body, like any swellings?
No.
Okay, have you noticed any loss of weight recently?
Yes, I lost 5 kilos in the last month.
And was it intentional?
Unintentional.
Intentional. Okay, Mr. Charles, thank you for the information. It was very valuable. I'll need to ask you some personal questions if you don't mind.
Yeah.
Like, what do you do for a living?
No, I am farmer.
You're a farmer.
Yes.
Okay, that's quite interesting. So, Mr. Charles, had this condition been affecting your work?
No, it is my son, and I have a machine for farming, so no problem.
Okay, very good. So, do you have any medical conditions that I should be aware of?
Like what?
Like hypertension, diabetes, problem with the heart, liver, or kidneys?
No.
Okay, that's quite reassuring for me. So, are you on any medications by any chance?
No.
Very good. Do you have any allergies?
To what?
Any allergies to medications, maybe to food?
I'm allergic to seafood.
Okay, I hope you don't like seafood then.
Yeah, no
Okay,
problem.
so Mr. Charles, do you have any like family member with a similar condition?
Yes, I think my grandfather died from cancer colon.
Oh, I'm really sorry to hear this. Please accept my deep condolences.
Yes, thank you.
Any other family members?
No, I don't remember, but it is many of the family have some sort of cancer.
Okay, it's fine. So do you smoke or drink, Mr. Charles?
Yes, I smoke 10 cigarettes per day for the last maybe 50 years, and also I drink alcohol in the weekend.
All right. Okay, so Mr. Charles, do you have any idea what might be causing you this altered bowel habits?
Okay, so you know, doctor, I am farmer. You know that we are working with cows and cultivated fruits. I have a small farm for flowers, so I don't have any idea about medicine.
Okay, that's totally fine. I'll understand your condition once we get to the bottom of it. So, do you have any specific worries or concerns, Mr. Charles?
No, no, I just need to know what is my condition, and I just need to solve the problem because it is annoy me.
Okay, so I'll make sure we do everything in our hands to help you, Mr. Charles. I just need to ask some other few really brief questions. Do you have any like heart racing, any
No,
shortness of breath?
no,
Okay, any like cold or heat intolerance,
no,
any tremors in your hands,
no,
any pains anywhere in your body?
no.
Okay, very good. Thank you, Mr. Charles, for asking my questions. I'll get back to my consultant and update you
Yeah,
as soon as
but you
possible.
ask about IC, you don't ask about E.
I didn't ask about
E.
systems.
No, 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 no. You
E
ask,
about the expectations, yes?
okay, you can ask me.
Okay, well, are you expecting any thing specific out of this consultation, Mr. Charles?
No, I don't understand you because you know that I don't know in medicine, so what I expected. You mean that you ask me what is my diagnosis or what is the treatment?
No, I'm okay.
Are you
I
the
understand.
doctor? Are you the doctor? So if you
Yes,
are the
sir, I'm the
doctor,
doctor.
so you're supposed to treat me or what you expect? What is I expected that you treat me?
Hmm.
Are you
Okay.
doctor? Okay,
Yes,
thank
sir.
you. All
Okay.
right.
Thank you.
Okay. Okay, Dr. Ismail.
Right.
So we start from this is what's your diagnosis first?
Okay, so my patient is a 65-year-old male patient. His name is Mr.
Yes.
Charles. He's a smoker, 10 cigarettes per day for the last 20 years, and he drinks alcohol occasionally. He presented with altered bowel habits for 2 months now between constipation and diarrhea. Normally, he has two motions daily, and it increases to 5 times of the diarrhea. The diarrhea is mixed with blood. There is no pain and no anal pain or swelling. He also lost 5 kilograms for the past month. However, there is no night sweat, no other swellings or lumps and bumps anywhere in his body.
Okay.
He works as a farmer. He has no chronic illness. He is not on any medication. He has no medication allergy. However, he has a positive seafood allergy and positive family history of cancer colon. My diagnosis on top of the list is inflammatory bowel disease, colon cancer. Might
No,
be
no, no.
diverted.
Choose, doctor. I don't ask you about differential diagnosis. What is your
Provisional
diagnosis?
diagnosis.
No, no. What is your final diagnosis?
My final diagnosis is inflammatory bowel disease, IBD.
Okay. All right. I don't agree with you.
Okay,
So
that's
why?
fine.
Why?
Due to loss of weight and positive
Okay.
family history, it might be colon
Yes.
cancer.
So what is your diagnosis?
So most probably colon cancer until proven
Colon
otherwise.
cancer. Colon cancer
Okay.
confirmed by investigation because apart from family history, this patient have loss of weight. It is important. I just to show you, you start good. When you ask about colonic symptom, because from the beginning it look like colonic symptom, but
Mhm.
you forget to ask about two items, something called tenesmus, which is incomplete evacuation, common with mass in the rectum or in the rectum or anus or colon, and you don't ask about fecal incontinence, who is unable to control, which is indicates sometimes with anal cancer. You ask about fever. Why you ask about fever? It is correct. We have a mark for it, big mark for it. So why we make a fever have a big mark?
Fever to exclude like the verticular abscess and also
Diverticulitis, many diverticulitis. So it is important. Any chronic symptom, you ask about irritable bowel habit, we already mentioned. Bleeding of the rectum, usually painless. Fecal incontinence, tenesmus, loss of weight, loss of appetite, and exclude by fever. So this is good. So this is first. Second, you ask about any lump and bump. I agree with you. You think that pump is an English word? It is English word.
yes.
Or are you sure? No, it is pump. It is like a rhythm. You know rhythm. Rhythm like song. So
Yes.
we don't have palm in the true English. And by the way, it may be in slang. It is like swelling, but it's okay. No problem. Okay. When I tell you I have allergic to seafood, don't. It is better to don't have a response, because you tell. I hope that don't like seafood or something like that. It is not logic to. It is like a joke or something, so it's not suitable in exam. All right.
Okay. So no jokes
So
during the consultation.
no, you can. I don't know, but it's sometimes, because this is history taken is different than communication skill, although it is one of the communication skill.
Yeah,
So
we're
it's
just trying
different
to
issue.
break the ice.
All right, Ken. So after the end, you ask about ICE. So first, what you expected in our culture, like British culture? I don't know what is your culture, but you expected that in England, or a book like Hampton Billy or Billy and Love, they in the history taken in this book, they mention ICE or not? In traditional,
Doctor,
in
I'm not really
traditional,
sure.
in traditional study in your college, you learn like this or not?
No, in my culture, like in Egypt, we don't actually
Okay, so if it
we
is
care
not,
about the patient concern only, but
no,
then we sometimes
if it
ask for
is
the
not,
idea.
it is not in culture in Egypt and not in our culture in England. So uh, it is not wrong, by the way. But what
Thank
is this? This ICE is coming from? You see the screen here.
you.
So if you can see, this is the paper for ICE. You see it? I make it bigger.
Yes.
Okay, so if you see the title of this paper, it is about what?
About ideas, concerns, and expectations. Yes.
Okay, in general practice, impact on, in red, written in red,
Impact on
in
prescribing.
prescription. So if you are in medicine, for example, and have a patient, and this patient have hypertension, and the patient, you give him some medication like beta blocker or whatever, and the patient say to you, okay, doctor, I will take it for 1 month, and after that I stop. So this is the patient expectation, because the patient don't think that he take a medication forever. But in surgical field, we don't have something like this. So if you are in lab exam or are in medical exam or you treat in medicine, because in medicine, if you treat a patient with diabetes, you mean that you treat it forever. Forever means that he takes the medication for long time till he die. Because this is like chronic disease. The same for hypertension. So this is the expectation. Usually the patient not expected to take a medication for long time.
So, sir,
Okay.
can I give a brief opinion on this, if I may?
Say again.
Can I
What you
give a
mean?
brief can I give a brief opinion on what you just said, if I may?
Yes, can.
Okay, so I went to Lab 2 twice, and ice was very crucial according to like
Yes. I
the
tell you in
courses.
the lab. I know that.
Yes.
If you take and Muhammad, what is name? Muhammad what? In Edinburgh. What is this man in London?
Mo Salah.
Sabri or yes, Muhammad Salah. Not the play
Yes.
for this man, the overweight man. Yes, I know that, because this is we make a tracing why this student say about ICE. So we found it is come from lab. I tell you that it's come from lab and from medicine.
Yes.
Yes, I
But
agree.
in MRCS, we've come across some stations where the
Yes.
patient is concerned about financial issues or work issues. He wants like a report for his work, or he has to leave the hospital for an important interviews or family at home. So I think when I ask for an idea or concern, I'm searching
Okay.
for these concerns that I should look for. But
All
I think
right.
that it should not take more than its like real weight. And when you, sir, replied that you are a farmer and you don't have, I didn't ask about the expectations because I see where
Okay.
it
All
was
right.
going, you know.
Okay. Which center you will take the exam? If you take it in Egypt, no problem. If you take in other country, so don't do that.
In Egypt, عادي.
Okay, so no problem. But if you take it in India, for example, the patient shouting to you. If you say
Okay.
that, he's shouting to you. So
Okay,
Dr.
so
Khalid Gohari. Okay. All right. So
thank
any
you,
other
sir.
Dr. Khalid
ازيك يا دكتور؟
Gohari?
ازيك يا
Yes.
الاخبار؟
Okay. You are welcome. All right. So it is up to you. By the way, for long time, the students say ICE is no problem at all. We just become strange because it is against our cultures. I don't work in Egypt. I am from Southeast Asia, but we don't have this also. But we found the Egyptian doctor when they came to our exam, they tell sad. So we have the impression that it is from the British Egyptian culture. So,
Doctor, does it matter for the examiner? I'm sorry to ask this question. Does it matter,
yes,
like marking wise to the examiner, if you think that the candidate in front of you is scripted or not? Does it make a
uh,
difference?
what you mean by the scripted?
Scripted, like he is scripted, he recalls all the answers and keeps like
Yeah,
memorizing the answers.
all Egyptian candidate, he have the same answer and the same mistake. This is why they are fail.
So it does it make a difference if the candidate is not scripted?
Okay, just a minute because I don't understand you. It means that all student
يعني
when
عايز اسال
enter the
حضرتك
exam, ah,
عايز اسال حضرتك لو الكانديديت اللي حضرتك بتمتحنه بيبقى
ah,
سكريبتد حافظ كل حاجه وقاعد بيرص الاجابات، دي
yes.
بتاثر على درجاته بطريقه ما، ولا مش
No,
بتبقى
but
فارقه؟
usually this is who tell like this, so they are not what is called, they have a wrong answer.
مهم.
Because
لا هو
this is why they repeat it. I just answer the one who asked about the culture. It is exam culture or Egyptian culture. Isn't actually it is British culture. So British culture is depend on the Hampton Billy and the Love. But in some country, sometimes we found the student have something related to their culture. Like for example, if you in your country they teach you different way insertion of the catheter or something like that. So we accepted that. Okay. Uh, we consider as a college Egyptian cultures is either one of the three. Either I think the names we know about it. It is not in my age. Like for example, Dr. Matari or Ali Hasib or I don't know the third one. So we review their book. We don't found that. Okay. So this is the official. Official mean like a book in the Kasr Al Aini Hospital, book in Shams University. Me not a consider as a reference. Others do not consider as a reference. Reference is just why the people teach 1,000 of students in Egypt. Egypt have a lot of students, maybe 1,000 is a big country. 90% of the candidate exams come from Egypt and India. Okay, so it is what is your culture is not like what's called official culture. Official culture being like in England, if I have debate with you and with other doctor in exam and happened, we have normal browse textbook or Billy and Love textbook. So if you found Billy and Love say something, it is can be practiced by me, but he don't mention that, so we consider Billy and Love is our reference. Most of the book all over the world, even in Egypt, is based on Hampton Billy and Love. So no one makes surgery from his like from his brain. He's usually, as I far as I know, they bring a British book and they make it summarize and put his name. All right. Okay, so we have Dr. Khalid Gohari be at the end. We can speak. Okay. All right. I will answer the other question at the end just to save a time. So it's still history taking and also alter bowel habit. So the patient have a same patient have alter bowel habit, but it's another complaint. Okay, can you start, Dr. Khalid Gohari?
Yes. Yes. Okay. Hello.
Okay.
Hello.
Hello. Yes.
Hello. I'm Dr. Khalid. I'm a surgical doctor. May I confirm your name and
Yes.
age?
Yes, I am 65. I am Mr. Charles, 65 years old.
Nice to meet you, Mr. Charles. Today I've been asked to talk with you about your condition.
Mhm.
First, mind if I'm taking some notes while I'm talking to you?
Yes, can.
Okay. So, can you tell me what brought you to the hospital today?
Yeah, I have just some blood appear in my urine in my stools for the last 2 months.
Blood in stool for the last 2 months. I'm so sorry to
Yes.
hear. So,
Okay.
can you tell me more about your condition?
No, it is about a small amount of blood, and this is mixed with a stool. It is not a fresh blood.
It's not a fish blood. Okay. So, does it associated with any pain?
No pain.
Okay. Do you notice what increased it or what decreased it?
No. Nothing increased, nothing decreased. It becomes spontaneous and suddenly relief.
So, is it getting worse or it's the same?
No, it is periodic. Sometimes worse, sometimes not worse.
So, it's not present all the time.
Yes.
Okay. So, do you have this previously?
No, first time.
It's first time. So, can you tell me if you have any anal swellings,
No,
any pain during defecation,
no.
any do you notice any unintentional weight loss?
No weight loss.
Okay. So, what about your appetite?
No, I eat normally, normal diet.
So, do you have any fever?
No fever.
Any long-standing constipation?
No.
Okay.
No
So,
alter bowel habit, no constipation diarrhea.
Okay. So, do you have any bloating,
No.
uh, any back pain or joint pain?
Yes, I have back pain, and I went to the doctor, and he diagnosed some disease in my vertebral column, but little joint pain.
I'm so sorry for this. Could you tell me what the doctor diagnosed you by what? Do you know?
He says something called ankylospondylitis.
Thank you so much for sharing this information. Thank you so much. Okay.
Yes. I have the X-ray. I think the doctor show you the X-ray.
Okay.
Okay.
Okay. I'll see it and I'll have a look on it. Okay. Thank you so much. Okay. Do you
All right.
have any heartburn or acid taste in your mouth?
No.
Any bleeding from any other orifices?
No.
Okay, thank you so much. Okay, can you tell me, were you diagnosed by any medical condition before, like increased blood sugar, increased blood pressure, increased cholesterol level,
No. I just have some eye problem.
eye problems? Okay, I'm so sorry for. Do you have a red? Is it red and painful?
Sometimes red, sometimes painful. But I went to the eye doctor, and he gave some drops to me, and he said it's okay.
And do you have any skin rashes?
No.
Mm, Okay. So, do you have any regular drugs, especially drug thinners?
No.
Do you have any allergies for food, any food or any drug?
No.
Were you hospitalized before?
Yes, I hospitalized before. Yes.
For what actually?
For they did colonoscope to me.
Colonoscope. Okay. So, do you have any informations about the result?
They make a colonoscope and take something called the bunch biopsy, and I think the result the examiner tell you about it.
Okay. Thank you so much about sharing this information. So, did you have any surgical operations before?
No.
Okay. Do you have any family history of the same condition?
In my family, I hear that my grandfather have the same problem, but I don't know.
I'm so sorry for this. So, Mr. Charles, are you smoking? Do you smoke or drink alcohol?
Yeah, smoking, because one of the doctor joking, he say, sometimes smoking improve my case. I don't know it is true or not.
Is it actually okay? So
No, the doctor tell me what you think.
yes. I will discuss with you later. Okay. So
All right, okay,
okay.
go
So
on.
about alcohol, do you drink alcohol?
Yes, but I stopped it 5 years ago.
Great. And do you have regular exercise?
Yes,
Great. And do you have a healthy diet?
yes.
Fabulous. Okay. So what do you do for a living, Mr. Charles?
Yeah, I am retired teacher. I teach English.
And do you live alone or with someone else?
Yeah, I live with my wife.
Do you have any recent travel, Mr. Charles?
Yes, I go to India.
India. Great. So
Yes.
and do you have any recent stress?
Life is usually have a stress.
Usually, occasionally. Okay, so I will ask you about some other systems. Do you have any headache or seizures or fits?
No.
Do you have any visual disturbance?
You have little problem in my eye, but the doctor say it will be improved soon.
Okay, I hope you will be improved. What about nausea and vomiting?
No, no nausea, no vomiting.
About neck swelling or neck stiffness?
Nothing. Normal.
Okay, about chest. Do you have any shortness of breath or cough?
No.
Any abdominal pain?
No.
What about your urination or defecation? Is it normal?
Normal, yes.
Do you have any weakness or numbness over your upper limbs or lower limbs?
No.
Okay, great. Thank you for sharing this information, Mr. Charles. Thank you
All
so much.
right. Okay, thank you. So I am now the examiner. I just need to show you. You ask the patient, he admitted. So the patient when he admitted, we did this X-ray to him. You see the X-ray?
لحظة
Shall I share again or what?
معلش هي مش واضحة قدامي.
Okay, I make it bigger. You see it? What does look like?
هي ظاهرة عند حد
مفيش
أصلا.
حاجة يا دكتور.
All
هي مش
right, so
موجودة
you
يا
need
دكتور
to
شيرين.
share. So you ask me to share. This is easy. Okay, I will share it. Okay. Okay. Can you see it now?
Yes, I have here some yes, the bamboo sign, which is
It is diagnostic for what? All right,
ankylosing.
bamboo sign. Okay, we
Yeah.
discuss this later.
Yes.
Okay, and this is the colonic picture. The colon
Okay.
picture. Okay, I remove the title. All right. So
Okay,
what's your
good.
diagnosis?
The patient here has many ulcers in the colonoscope in the colon, so I'd like to consider it as an ulcerative colitis for an IBD.
What is ulcerative colitis?
It's ulceration of the colon with the.
What is the cause of it?
It's autoimmune. Could be autoimmune.
I think we don't know till now, but can be autoimmune. All right, okay. So in this ankylosing spondylitis, apart from Schubert test, use it for physical examination. What is other lab test you did?
I can do the lab test, the usual lab test.
What is called?
Okay. What?
What is the name? This is like some markers called H something.
H
HLD B
27.
HLD version. Okay.
Okay, what is this? What does HLD mean?
Human leukocytic.
Human leukocytic antigen, because they discover a leukocyte. After that they found in all cases. So this is why it is HDL is human leukocytic antigen, but it is present in all cells have nucleus. Okay, so why is this patient not a cancer?
Because the patient did not denied any constitutional symptoms in the form of loss of weight and loss of appetite. Also,
okay, so you mean that the patient have no constituent symptom, because denied in English language, it means that what deny mean?
اللي هو أنكر يعني بس okay.
All
So
right. So deny means that you don't tell the truth. In the
Yes.
some country like Southeast Asia, they used to do that. They mean deny mean no. But in the Middle East area, deny means that you don't tell the truth. In English, it is not tell the truth. So the patient not deny. If you say the patient deny in front of the patient shouting to you. So the patient is no something, no something. This is can be diverticulitis.
No, it's not. It cannot because there is no fever.
No fever. Okay. All right. So this is risk conditions. Is ulcerative colitis is risky or not?
Ulcerative colitis is comes in attacks, so the patient have to be
No,
treated.
risky in surgery means that can cause cancer or not?
Ulcerative colitis, yeah, yes, it can cause cancer.
It is
That's
pre-cancerous condition or risk of malignancy, and what is the difference?
actually I don't know.
Okay, so ulcerative colitis, if you say ulcerative colitis is the risk of malignancy and familial adenomatous polyposis is pre-cancerous condition. So what is the difference?
Okay, so the familial adiposis, okay, the ulcerative colitis risk for malignancy, yes, because it's due to chronic irritation. So it by long term, it's not genetic. It's by due to
No, yes, it means that the risk of malignancy means that some patient, if ulcerative colitis, can develop cancer. It is like smoking have a risk of cancer lung, but not all smoker, not all ulcerative colitis patient have cancer colon. The same familial adenomatous polyposis is pre-cancerous condition, means that all patient, if they still alive till age of 40, we don't remove the colon at age of 30, 100% of them will develop cancer colon. Okay. All right. Okay. So we have another script. After that, we stop and open for discussion. I share again. So anyone?
شكرا دكتور شيرين.
Okay, you are welcome. So this is 65 years old man, chronic smoker, complain of vomiting of blood. Yesterday, he admitted in surgical ward. So vomiting of blood. Okay. So anyone?
لو ما فيش حد انا ممكن اخدها دكتور.
Okay, this suddenly people is shy. Muhammad Rajab again. Ahmad Fathi. Okay, then who speak last one? Who is that?
انا محمود زهرة يا دكتور شيرين.
Okay, so Zahra, so can start, no problem. We have two script from this, so we need another one after you, so you can start.
اوكي هقرا بس
Okay.
السكريبت.
All right, okay. So I am 65 years old, chronic smoker, complain of vomiting of blood, and admitted to surgical ward.
Okay, shall we start?
Okay. Yes. Again, in the same, after Dr. Zahra finish, we need another one. We have the same script, but the answer is different. Okay. After that, we answer your question. Okay, you can start.
Okay. Good afternoon. I'm Dr. Mahmoud,
Yes.
one of the surgical doctors. May I confirm your name and age, please?
Yes. I am Mr. Charles, and I'm 65 years old.
Nice to meet you, Mr. Charles. Can I take some notes while I'm talking to you, Mr. Charles, if you don't mind?
Can, no problem.
Okay. How can I help you today?
No, I just yesterday I have vomiting of blood, and I came to the hospital and they give me fluid and blood.
I'm really sorry to hear that. It seems a very
Mhm.
stressful condition for you. Can you tell me more about your condition? Like
No, it is yesterday in evening. I just have just sudden vomiting of blood. It is
it
fresh
is the
blood.
first time to have this
First,
condition.
first time.
Okay. What you told me the amount of the blood.
It is half cup. It is half cup.
Half cup. Okay.
Fresh blood, not mixed with food.
Okay. It's red or dark red or bright.
Bright red, fresh red.
Do you take any medications to relieve this condition?
No, I just came to the hospital. I became in panic. I came to the hospital.
Okay. Can I ask you more questions to analyze your condition, Mr. Charles?
Yeah.
Have you had any unintentional weight loss recently?
No.
Okay. Any loss of your appetite?
No.
Okay. Is there any pain with the vomiting?
No.
Okay. Any night fever, night sweats or fever?
No. Before you continue, doctor, because this is vomiting blood, is come from which organ?
Vomiting of the blood, from the esophageal varices.
From
ممكن.
esophagus. So what is the
لا،
function of esophagus? What is the function of esophagus?
dysphagia. ماشي.
Okay, so you need to ask about difficult to swallow. It is important to ask
Yes.
about the main organ function.
أنا لسه هسأل والله بس ماشي.
All right, okay, because you start to about other system and you start to ask about other
أنا قلت
topics.
هاخد التيومر الأول وأشوف في
Okay,
فيفر وبعد كده
all right, okay. So why you ask about fever?
فيفر استبعد ان كان في اي انفلاميشن مثلا esophagitis او
All
حاجه
right,
بس دي
okay, all right. Even esophagitis, I
infection
think,
يعني.
don't cause fever. No problem. Go on. So you can ask.
Okay. Do you have any difficulty in swallowing to food or fluid?
No,
Okay. Do you have any bad odor from your breath?
no,
Okay. Do you have any change in your taste, like
No.
acid taste?
no.
Okay. Do you have any swelling in your neck?
You mean right side or left side?
Any side?
No, no, no swelling.
Okay. Do you have any do you take any medications like blood thinners
No.
Okay. Do you have any bleeding from other orifices?
No.
Like okay. Okay, Mr. Charles, I want to ask you some more questions if you don't mind.
Okay, you can ask.
Okay. Do you smoke, Mr. Charles?
Yes, I smoke 10 cigarettes per day for the last 50 years.
Do you drink alcohol?
Yes, I drink alcohol. I drink a lot. I drink one can of alcoholic beer every day.
Okay. Have you ever been diagnosed with any medical condition like diabetes or hypertension?
No.
Okay. Have you ever been hospitalized before, apart from this time?
Yes, 30 years ago, I have motorcycle accident. I have fracture left femur. I admitted to the hospital and the doctor make an operation for me, something called intramedullary nail. During this time, because I was shocked, they give me blood. 2 weeks after that, I still in hospital. I have yellow color, they call it jaundice. And the doctor say I have hepatitis.
I'm really sorry to hear that. Seems a
Yeah.
very stressful condition. Do you take any medication for the hepatitis?
No,
Or vaccine?
actually, unfortunately, at this time, because it is 30 years ago, so it is 1990. At this time, we don't have vaccine and interferon is not discovered yet, so we don't have medication. But I know in news in 2000 that they have vaccines and medication for that. I went to the hospital. They tell me that is they are already the hepatitis affect your liver, and now you are not in active stage. So the treatment and vaccination of no value. But they
Okay,
give me
thank you.
vaccination just for future. Thank you.
Thank
Okay.
you for sharing this information with me. Just
Okay.
more question regarding your personal life. What is your job, Mr. Charles?
I am teacher
With whom do you live?
with my wife.
Okay, what is the level of your activity?
No, it is normal, but this is affect. Sometimes I have lower limb edema. Sometimes I have some easy fatigability because of the affection of liver.
Okay, I understand that. Do you have any allergies from your food or drug?
No,
Okay. Some more questions to review the other system. Do you have any tremors or or weakness in your upper limb or lower limb?
No,
Any shortness of breath?
no,
Any feeling of your heartbeat?
no,
Any problem in your urination or defecation?
no.
Okay, thank you for
Okay, all right.
your valuable
Thank you.
information.
So this
I
is
will-
easy station, and sometimes it's difficult because if you don't ask about admission or previous hospitals, you forget the idea. What's your diagnosis?
My diagnosis is esophageal varices
Due to
due to hepatitis.
due to liver cirrhosis.
Liver
Hepatitis is
cirrhosis.
gone. Portal hypertension, liver cirrhosis. What is the cause of liver cirrhosis in this patient?
I think blood transfusion.
And hepatitis, you mean hepatitis
Hepatitis C, hepatitis,
and alcohol because he drink
Alcohol.
alcohol. Okay. So can
بس-
have the same scenario. Okay, you can ask what you need to ask.
بس هنا اظن لو هو قال لي كده يا دكتور شيرين وهو نقل كذا كيس دم ما اظنش يبقى هو هيباتيتس سي هو انا فاهم ان الالكحول ريسك فاكتور بس ما هيبقى اقوى ان هو عمل عمليه ونقل دم صح كده؟
Both
بس لازم
can
أقول لك-
affect the liver. If the patient have liver cirrhosis due to alcohol, which is common, and can be due to anything is the same, no problem. But usually have many factors. Alcohol can affect, hepatitis can affect, both can affect, and later this patient can be develop hepatocellular carcinoma because of cirrhosis, whatever the cause of cirrhosis. Okay, I just come to you back, so can ask Dr. Ahmed Fathi, for example, or anyone, or Muhammad Ragab, can take the same history again with little change in the response.
Yes, I am ready.
Okay, it is important to know that all scenarios in the college have many many subscript. Okay, you can start. You can start, Dr.
Okay.
Ahmed. All right.
محمد رجب.
محمد
دكتور
رجب.
اي حد
محمد.
يبدا دكتور احمد او يبدا خلاص اي حد
Anyone.
لو حد يا دكتور ممكن يشارك عادي، انا شاركت لو في حد يشارك.
هو في دكتور دي ام بس انا I don't know what his name. You share
هو-
before
وأنا معك-
Dr. DM.
وأنا معك.
What is
انا
You
معك
are-
دكتور شيرين بس المشكلة
Hello.
إنك في الشارع بس.
Hello,
أنا-
Dr. Shireen. How are you?
yeah fine. Are you Dr.
Alright, my
Osama
name
or whom?
No, I'm Dr. Mahmoud Rashid.
Okay, Dr. Mahmoud. So you can start. Where are you from? Which country?
From Egypt.
Okay, you are welcome. So you can start. All right, you can start.
Okay.
The same
This
script is the same scenario. 65 years old and have vomiting of blood. Yesterday. You can
Okay.
start.
Hello, I'm Dr. Mahmoud Rashid, one of the surgical doctors. May you confirm your name
Yes.
and age, please?
Yes, I am Mr. Charles. I'm 65 years old.
Nice to meet you today, Mr. Charles. So, do you mind? Okay, so please, may you tell me what brought you here today?
Yeah, yesterday when I watching the TV, I found I vomiting blood.
I'm really sorry for that. All right. Okay. Do you mind if I just talk some notes behind while we're talking?
Okay, you can, no problem.
Okay. So regarding vomiting blood, would you tell me please more about that problem? What happened?
So it is half cup of blood mixed with food.
All right. So is it fresh blood?
No, it is mixed with food.
All right. So it's mixed with food. Okay. So like was it the first time it happened or happened before?
Yes, first time.
First time. All right. Okay. And may I ask you some questions regarding this problem, please?
Yeah.
Okay. May I ask you, please, did you have or noticed unintentional weight loss recently?
Yes, I lost 5 kilos in the last month.
Okay. All right. What about your appetite? Have you noticed any
It
loss?
is okay, but I have difficult to swallow, so I don't eat much.
Oh, okay. So this swallowing, difficulty swallowing, is it related to water or solid or both?
No, it is solid.
Solid. Okay, I see. So also, would you tell me please, do you have any lump or swelling in your neck from right or left sides?
No. But if I tell you I have dysphagia, so it is logic to ask me which level you have dysphagia. Is here or here or here?
Okay.
Okay.
Regarding this, the dysphagia, like, is it
Difficult to
from?
swallow, yes. The food is
Yeah.
stuck in the lower part of my chest.
All right. Okay. The lower part of your chest. I see.
Yes.
All right. So, so I need to ask you just that question about, do you have any heartburn?
Yes, I have in the last 5 years, I have something called reflux. I went to the doctor. The doctor gave me some medication and
Hmm.
also asked me to avoid spicy food. I take a
Yeah.
medication for 1 month, but I know I like spicy food, so I don't stop spicy food. And also he asked me to continue with medication, but I forget to take it.
I understand. All right. And of course, you feel that acid taste at the back of your throat, right?
Yes, yes,
Okay. Do you have any pain while you swallow?
no,
Okay. So no pain swallow. All right. So also I would ask you, please, do you have any problem, any other medical conditions like diabetes, hypertension?
no,
Okay. Have you done any surgeries before or hospitalized before?
no,
Okay. Also, I would ask you, please, have you done, have you taken any medications? Do you take any regular medications?
no. It's supposed to take, this is proton pump or anti-acid medication, but I don't take it.
Okay. Have you investigated before for that problem? As you mentioned that you
Yes,
had.
5 years ago, the doctor did something called the OGD to me, and they say I have some sort called reflux or GERD,
Okay.
GERD. Okay.
Okay. Have you done any for the result of this endoscope? Is it with you right now?
Yes, but actually, yesterday they also, today, I think today morning they did endoscope, so I will show you soon.
All right. Thank you. Also, I would
Okay.
ask you, please, we mentioned that like you don't take any regular drugs. Okay, so
Yes.
do you have any allergy regarding to drugs or foods overall?
No.
Okay, regarding your family history, do you have any other member of your family who had the same problem before?
No, but I think my grandfather died from heart attack.
I'm really sorry for that. Please accept
Thank you.
my sincerely condolences for that. All right. I would ask you, please, more questions. Me tell me what do you do for a living, please?
No, I am teacher.
You're a teacher. All right. And do you live alone or with somebody?
Yeah, I live with my wife.
Okay. Do you smoke, Mr. Char?
Yes, I smoke about 10 cigarettes for the last 50 years.
The last few years. All right. Okay. Do you drink alcohol?
Yes, I drink 1 can of alcoholic beer every day for the last 20 years.
Okay. Other questions regarding like, do you have any shortness of breath?
No,
Okay. Did you have any fever recently?
no, no,
Okay. Any water problem in water work or bowel work?
no,
Any muscle weakness or
no,
numbness?
no.
All right. Okay. So, Mr. Richard, that's all for today. Thank you for sharing
Okay.
all these informations with me. I will
Okay.
get back to my consultant.
All right. So
And
what's your diagnosis?
my diagnosis is till now is Barrett's esophagus.
But it is the Barrett esophagus 5 years ago.
So
And the patient now have dysphagia and loss of weight. Okay,
so
I show
I
you
would,
the colonoscope. This is the colonoscope. What you think? You see the picture?
I see the picture. There's like
So
polyp. So I would say cancer. Adenocarcinoma.
adenocarcinoma of lower esophagus. Why you say that? Because
Because
of
he showed symptoms of loss of weight recently, and also showed positive symptoms for
so what is the cause of this cancer?
It's the
mentioned in front.
esophagus. The
What is
esophagus.
esophagus? Yes, yes, correct. What is Barrett?
Esophagus. It's chronic change of the
Metaplasia.
epithelium.
Metaplasia.
Metaplasia or
What is
changing of the
metaplasia?
lining.
What is
Metaplasia is reversible changing of the lining epithelium from in Barrett from simple non-stratified non-keratinized stratified squamous epithelium to simple columnar epithelium with goblet cells.
Yeah, it is correct, but actually it is reversible. Irreversible have controversy. I explain to you later. So this patient, why this patient develop the cancer? Some patient not develop cancer.
Because it is it's an
So
it's not
suppose
precancerous, but
suppose
it's,
this patient take a treatment like omeprazole and the surgeon advise him to do laparoscopic Nissen fundoplication. He develop cancer or not?
I think not, because he's taking
Not
protein.
okay. So no, because he take a treatment. If you treat reflux, the patient have Barrett esophagus can improved, but if not take a treatment and the Barrett is developed, so can be metaplasia and dysplasia and change it to be cancer. Okay.
Yeah.
All right. If you compare this scenario to the first scenario, so the same script, the same data, the same vomiting of blood. The problem, it is important to ask about organ, which is esophagus. So you need to ask about dysphagia. Okay.
Dr. Sheen,
All
can I
right.
ask,
Okay, doctor.
in
Yes.
the first case, Dr. Mahmoud Zahra answer for it. Is it esophageal paresis? What analysis of esophageal paresis? Can I ask swelling in hertomy, history of blood transfusion, and Eulis
No.
discoloration?
If you need to ask about hepatitis to go cirrhosis, you can ask, of course, he take blood transfusion, but you can ask about like tattooing. You can ask about some sexual intercourse with partner, if partner have hepatitis. You can ask about intravenous drug abuse. So this is cause of hepatitis, and this cause of hepatitis can be complicated by liver cirrhosis. But the patient from the history is already have hepatitis due to blood transfusion, so this is confirmed.
Yes, I can
Okay.
add if he has tummy swelling, if he has a Eulis discoloration. Can I?
You can
That's it,
ask,
or
no problem. You can ask, no problem. Not make much difference.
okay?
Okay. All
Thank
right.
you.
I just answer your question or some question for you. All right. So I just, by the way, because I write in my notes